Sean and Sue, and we are at the Pacifico patio, powered by RWJBarnabas Health. It is a Friday in Seaside Heights. We're at the beach, and joining us today, our guest, Dr. Mark Ferretti, MD and Urology Specialist, Community Medical Center, and RWJBarnabas Health Medical Group. Dr. Ferretti, thanks for being with us.
Thanks for having me, Sean and Sue.
All right, so what urologic symptoms should patients always take seriously and bring up to their doctors?
Thanks for asking me this question. There's two symptoms that I think really should be highlighted. One may seem obvious, but it's so important that I just want to bring it up, and that's when you see blood in the urine. Anytime you see blood in the urine, that's something that you should immediately seek medical attention for. There's a number of things that you want to work up in a timely fashion, and anytime you have blood in the urine, you need to see a physician, and you should see a urologist. The other one, which may not seem as obvious, is anytime you have erectile dysfunction. The erectile dysfunction can be a canary in the coal mine for a number of cardiovascular diseases and other general health problems that time and time again we see uncovered by that presenting symptom. So those would be the two that I'd really stress.
Okay. Thanks.
Doctor, what cancer screening tests are available for urology, and when should patients start asking about those?
Another good question. Thank you. One would be screening for kidney cancer and bladder cancer with a urinalysis. And that's often done by the primary care doctors on a yearly basis, starting around age 30.
Oh, wow.
And that can help uncover occult bladder cancers or occult kidney cancers.
Wow, that's
the
young.
other one.
I didn't realize it was so young, doctor.
Yes, a lot of
Wow.
a lot of patients should be screened with the urine test, even starting as early as age 30.
Wow.
The other test would be the PSA. Now, there's different guidelines for different societies in terms of what their exact age recommendation is. But there was a recent study that showed that getting even a one-time PSA test, which is a screening test for prostate cancer, it's a prostate-specific antigen. It's just a blood test. Getting a one-time test in your 30s or 40s can also help with risk stratifying you and putting you into the correct screening protocol for when you start the yearly or every 2-year protocol in your 50s.
All right, thanks for that, doctor. And one more question, and I will tell you what, I know a lot of people who have had them. How can someone prevent kidney stones? They're so painful.
Yes, and anyone who's had a kidney stone definitely wants to prevent it. They do not want one again. And prevention is the best medicine. So the number one gold standard medication is water. So staying hydrated, and particularly hydrating to the point that your urine's clear, has been shown to significantly reduce the recurrence rates of kidney stones. When you have a kidney stone, you have about a 50% chance of having another one again in your life, and you can reduce that significantly, cut it basically in half by drinking water till your urine's clear.
It's amazing. All right. Well, that's good to know because, I've heard some stories, doctor.
Oh, yeah.
Oh, my goodness. Well, doctor, thank you so much for taking your time and talking all about these important needs for everyone.
Thank you so much. Thanks for having me.
To learn more about Community Medical Center, visit rwjbh.org/community. Thanks to Dr. Mark Ferretti on 92.7 WOBM, now in Monmouth County on 96.7.